Okay, so we are here where we're going to try to evaluate a label. What is important on the label, what to identify on the label to determine how to proceed when we're adding our diluent to achieve the required concentration as stipulated by the manufacturer, or to adjust that concentration to obtain a concentration that is much more dilute than what the manufacturer would have stated. So we need to first identify the active ingredient and the amount of active ingredient in a particular volume. Usually, it is generally seen that the active ingredient is stated in amount per 5 mils for oral preparations. For parenteral preparations, you may see the entire amount of active ingredient that will be contained in that bottle, or they may state the amount per mil. So you have to look out for that. Look out for the concentration. Once you know the concentration, you can do any form of calculation you wish. So in this case, augmentin contains two different drugs. It contains amoxicillin, 125 milligrams per 5 ml, as well as clavulanic acid, 31.25 milligrams per 5 ml. So this is a fixed dose combination suspension that contains two different drugs. And this is an antibiotic, by the way. We also need to identify, of course, the concentration, which is stated here. I want you to recognize here that for augmentin, the amoxicillin concentration is stated on the bottle in big bold letters. What does this mean? Does it mean that clavulanic acid is not important? No. Clavulanic acid is not an antibiotic per se, but it assists in the stability of amoxicillin. So it's really there to help out the amoxicillin to make it more potent. So it's not fighting against an antibiotic directly, but indirectly it is allowing the amoxicillin to remain potent enough to fight those bacteria in our system. So it's not listed there, but if we look here in the circle, we see what is the amount of each of these components in every 5 mils. We also need to determine the amount of diluent that needs to be added according to the manufacturer to obtain the volume of 100 mils. So we recognize we need 90 mils of purified water to be added to the powder to reconstitute it to a 100 mil suspension that will contain 125 milligrams per 5 mil. You'll see other information on the label, such as keep tightly closed, because it's a powder, so you're going to have to keep this tightly closed, preventing moisture from reaching it, because we know stability issues with amoxicillin and aqueous medium. Shake well before using, must be refrigerated, and discard after 10 days. So the beyond use date for this reconstituted suspension, that means after you've added the diluent to make the suspension, it's only good for 10 days once stored in the fridge. Okay, so these are very important information. Also, it gives you the direction for mixing, tap bottle until all powder flows freely, etc. So all of that information is here. Okay. Okay, so what do we do with this? I mean, if we are working in the pharmacy and the pharmacist says to us, can you prepare this reconstituted suspension for me? You first have to determine what is the concentration of amoxicillin and clavulanic acid in the suspension after reconstituted. We have identified that as 125 milligram per 5 mil. What volume of diluent must be added to produce this concentration? We need 90 mils of purified water. What is the final volume after reconstitution? It's 100 mils. And what volume does the powder occupy in the suspension? Now, while we can get the first three questions from the label, we are going to have to determine the volume that is occupying, the volume that the powder is occupying in the suspension once it's reconstituted. Notice we only add 90 mils, but we end up with 100 mils. So what do you think the volume of the powder that it will occupy in the suspension. Well, in order to determine that, we need now to note that total volume of the suspension would be the volume occupied by the powder plus the volume of the water added. We know the volume of water added to be 90. So therefore, the volume occupied by the powder would be total volume of suspension minus volume of water added, which will be 100 minus 90, which is 10 mils. So while you will not be able, the manufacturer is not going to put on the label the volume that the powder will occupy once the mixture is reconstituted, you're going to have to determine that from the information that you have. And the information can be had from volume once the powder is reconstituted, that's the final volume of the suspension, and the volume of the diluent that you need to add to make this 100 mils. Subtract both and you will end up with the volume occupied by the powder in the suspension. Another thing is the total amount of amoxicillin contained in the bottle. Why do we need to determine the total amount of amoxicillin in the bottle? What comes to mind is that you may be given a prescription that will require, say, I don't know, maybe 10 days supply at a particular concentration or at a particular dose. So the doctor may order, say, 500 milligrams 3 times a day or 2 times a day for 10 days. You're going to have to determine, based on that drug regimen, the total amount of amoxicillin that the person is going to need for those 10 days. And you're going to have to figure out more or less whether the stock that you have, the bottle of augmentin that you have, will cover for the 10 days. Sometimes it will cover it, more than cover it, because you will have some suspension left that you will have to tell the patient to discard. But sometimes it's not going to be enough, and you're going to have to calculate the number of bottles that the patient will have to get in order to cover the drug regimen. So it's important to be able to determine the amount of amoxicillin that would be contained in the bottle. That can be determined, however, from the concentration. Once we know the concentration of amoxicillin, which is every 5 mils containing 125 milligrams of drug, then we can determine how much would be in the entire 100 mils when reconstituted. So the total amount of the amoxicillin then that would be in 100 mils once the powder is reconstituted can be determined by ratio and proportion. If 125 milligrams is contained in 100 mils, in 5 mils, then the amount of milligrams contained in 100 mils would have been 2,500 milligrams. So this is saying that once you have reconstituted that 100 mil to 100 mil suspension, you should have 2,500 milligrams of your active ingredient amoxicillin in the entire bottle. As a matter of fact, even before you reconstituted, that amoxicillin is found in the powder. 2,500 milligrams of amoxicillin will be in the powder. But I need to hasten to say that that powder that you're seeing in the bottle before you reconstitute it is not only amoxicillin. You have other things in there. Remember that the manufacturer would have made the suspension, then remove the water that is used to make the suspension. So what is going to be left back would have been flavorants in a powder form. What would have been left also would be sucrose in a powder form, and other things like preservatives and thickeners and all of those things, in addition to the 2,500 milligrams of amoxicillin. So when you see that powder in there, it's not only the drug, it's the drug plus other excipients. And I want that to be abundantly clear. Okay? So once you can determine the amount of drug that is contained in a particular volume, then you can determine the total amount of drug that would have been in that one bottle. which is quite useful, as I have said before. What is the total amount of clavulanic acid? Same principle applies. You know that 31.25 milligrams is contained in every 5 mils. Therefore, you can determine the total amount of clavulanic acid that would have been in the 100 mil had you reconstituted it, and that would have been 625 milligrams. Okay, so we are to use the label instructions in the figure at the side, not above, to answer the following questions. We are to calculate the total content of amoxicillin contained in the dry powder of the product. Now, remember, even though we reconstituted to make a particular volume, the drug is already in the powder. It's there already, but we just need to reconstitute it. That is why we have this concept of reconstitution and admixtures, because you're adding a diluent to a powder formulation to produce a liquid. So you're really reconstituting it. You're adding back the water or adding back the diluent to the powder to make your suspension or solution, depending on what the manufacturer has done. So here they're asking you to calculate the total content in the powder. Now you are to use the information that's on the label. So we have to use the concentration. And where do we find the concentration? Right here, 250 milligrams per 5 mils. What else do we need? We need the total volume to be made when reconstituted, which is 80 mils, and we find that right here, 80 mils when reconstituted. So if we know the concentration, which is 250 milligrams of amoxicillin in every 5 mils, we know that when we reconstitute it, we're going to end up with a total volume of 80 mils. Then we can determine the total amount of amoxicillin that would have been in the 80 mils. So if 250 of amoxicillin is found in 5 mils, then the amount that would be found in the 80 mils once reconstituted would be 4 grams or 4,000 milligrams. Now, does that mean that I have to reconstitute it to make the 4 grams be there? No, the 4 gram is already there. It's already in the powder. But we are using the concentration that would have been resulted once we add the diluent and the volume that would have been resulted to determine what the amount of amoxicillin the manufacturers have put in that powder. Calculate the volume occupied by the dry powder. Now the powder in there is dry. We're not going to take out the powder, use our physics knowledge and use picnometer to determine the volume. No, we can determine the volume by 2 things. One, the final volume once reconstituted, and the other is the total amount of diluent that the manufacturer says we are to add. So the volume occupied by the powder would be total volume of the suspension minus the volume of the water or the diluent that we need to add. The total amount of water to be added is 55 mils, and the total amount of mixture, I'm sorry, let me go back, total amount of mixture would have been 80 mil as was stated earlier. So in order to determine the volume occupied by the powder, we subtract 80 mils, 55 mils from 80 mils to get 25 mils. Okay, so we have this. The physician orders the following medication order for a 50-pound child. And the drug regimen is amoxicillin, 125 milligrams every 6 hours for 7 days. Question asks, what volume of suspension will be produced if the stock of amoxicillin powder for reconstituted is diluted such that 125 milligrams of the drug be contained in 5 mils? Calculate the volume of water to be added to the powder as well. Now, this is where our concept of ratio and proportion, our concept of interpreting prescription orders comes in. We would have to have that groundwork first in order to be able to do this kind of calculations. Of course, we would also need the concept of dilution and concentration to assist us. So we have a stock of 250 milligram per 5 ml reconstituted powder, but the prescription calls for 125 milligrams every 6 hours for 7 days. And the doctor went on to stipulate that he wants this dose of 125 milligrams to be placed in every 5 mils. So you're going to have to use the stock that you have to do that. One way, this can be done in 2 ways. The obvious way that you and I or any layman would think is that we make the 80 mils of amoxicillin to produce a concentration of 250 per 5 mil and give the person 2.5 mils that will contain the 125. And that would have been fine because the person would have been getting 125 milligrams, which is what the doctor ordered in his prescription. However, the doctor was very specific. The doctor says he wants 125 milligrams to be 5 mils, not 2.5. So it means then that the second method would be to dilute that 80 mils to make 125 milligrams be now in 5 mils. So you're going to add more than the 55 mils of water to this powder to end up with a concentration of 125 milligrams per 5 mils. And that is our task. So let's proceed. We have to first identify what is available. And what's available to us is a 250 milligram per 5 mil stock. When reconstituted, has a volume of 80 mils. We also want to reconstitute the stock such that we end up with a concentration of 125 milligrams per 5 mil. What does this mean? It means then that I'm going to have to add enough water to all of this stock to end up with 125 milligrams. It means I'm going to have to dilute everything. We do not know the final volume of the diluted suspension, meaning that if I add enough water to the 250 milligram per 5 ml stock powder, I am not going to know what the final volume is. I know I'm going to add water in, and I'm going to add sufficient water or enough water such that the concentration is now 125 per 5 mils. But I won't know what the final volume will be. I have to determine that. But what we do know is the amount of drug that is in the stock, that is in the powder, right? And remember how we determine that? To determine the amount of drug in the stock, we'll have to use what? We'll have to use the concentration of the stock. And the concentration of the stock says 250 milligrams of drug is contained in every 5 mils when you reconstitute it as all the manufacturers indicating to us we should reconstitute it. So if I add my 55 mils to the powder, I'm going to end up with a concentration of 250 milligrams of drug in every 5 mils, and I'm going to end up with a final volume of 80 mils. So therefore, I can determine the total amount of drug in that 80 mils, which is 4 grams, as we have already calculated previously. What does this mean? It means, if you remember from our dilution lecture last time, that if we are going to now dilute this 4 grams will also be in the diluted mixture. The only difference is we don't know what the final volume of the diluted mixture is going to be, but we know, one, the concentration that it should be, and we also know the total amount of drug that is supposed to be in there. So we identify the concentration of the diluted suspension, which is 125 milligrams per 5 ml. So now we have all the tools or all the information to determine the final volume of the diluted suspension. We're going to use the diluted suspension's concentration. If 125 milligrams of the drug is contained in every 5 mils of the diluted suspension, that is what we want. That's what doctor wants. He wants the dose 125 milligrams to be in every 5 mils. And we also know that 4 grams or 4,000 mils is in our stock that we're going to dilute. Then we can determine now, based on that concentration, what would be the final volume. So if 125 milligrams of drug is containing 5 ml of the diluted suspension, then 4,000 milligrams will be contained in X, and that will be 160 ml. So we haven't done anything yet, you know. We have the powder, the bottle with the powder sitting right in front of us, but we're doing the calculations. We are like Doctor Who. We go into the future, and then we come back in the present and make all the preparations. So I went into the future, and we recognized that knowing the concentration of the diluted suspension that we want, and knowing the fact that we are going to have to dilute all of the stock that we have, which contains 4 grams or 4,000 milligrams of drug, then we can determine then, based on this new diluted concentration, we can determine what the final volume is based on ratio and proportion. But it doesn't end there. We know that 160 mils of the diluted suspension is going to result from our adding of the diluent or the water to the stock bottle. So we're not going to get 80 mils now. We're going to add until we get 160 mils. And we're going to end up with a concentration of 125 milligrams per 5 mils. But what does that mean? How much water do we add? So we remember that in order to determine the amount of water to add, we need some information. We need the volume occupied by the powder, and we also need the final volume. And we have 2 of them. We know the volume occupied by the powder. We know that the powder, based on the stock bottle and the stock bottle information, we know that we are going to add 55 mils to make an 80 ml reconstituted suspension. Yes? So if we're adding 55 mils to the powder to end up with 80 mils, then we can determine then what is the volume occupied by the powder, which is 25 mils. So if we go back now to what it is that we want to find the volume of water to add. Can't add 55 mils, because if we add 55 mils, we end up with 80 mils. We want to end up with 160 mils. So therefore, we're going to have to use the total volume of the diluted suspension, which is 160 mils. And we're also going to need the water, the powder, the volume occupied by the powder. And we need to do a subtraction, and we end up with 135 mils. So let's recap. We are going to get a final concentration of 125 milligrams per 5 mils. We know that we are going to have to dilute our 250 milligrams per 5 mil stock that we have, all of it. So we're going to add water until we end up with a concentration of 125 milligrams per 5. We don't know how much water we need to add, but we need some information to help us to get there. So we turned Dr. Wu and we went into the future. In the future, we know that once we dilute it, we're going to end up with a concentration of 125 per 5 mils. We also knew from the past that 4,000 milligrams of the drug will be contained in the stock. So if we dilute all of that, it means that the same 4,000 milligrams that was in the stock will also be in the diluted suspension. So once we have the concentration of the diluted suspension and the total amount of drug that would be in the diluted suspension, then we can determine what the final volume would be. And we found that to be 160 mils. 160 mils will be the final diluted suspension's volume. But we need to know now, we need to go back into the past to add enough water to make this 160 mils. So how do we do that? We need to know the volume occupied by the powder. So we determined that using the information on the stock bottle. The stock bottle says when we reconstitute We add 55 mils of water to the powder and end up with 80 mils. So the powder occupies a volume of 25 mils. Once we know that, then we can subtract that 25 mils from the 160, which is the final diluted suspension's volume, to get the total amount of water I need to add. So this means that I'm going to now move from the future back into the past. I'm going to take my stock bottle that has the reading on the label 250 milligram per 5 mil, and I'm going to add 135 mils of water in that bottle, shake it up, and I'm going to end up with 125 milligram per 5 mils times 160 mils. Now you may be asking, and I know if you're my students in your thought, you're going to be asking, but miss, the bottle can only hold 80 mils. How is that going to work? Excellent question. It means you're going to have to find another dispensing bottle that can hold 160. You are going to have to put water, a little bit of water into that stock bottle, shake it up, and try to rinse as much of that powder out of that bottle. Pour it into the other dispensing bottle, and of course, add until all of the water, all of the 135 mils of water has been used up. And that is how you solve that problem. All right, good. Now this is our question. Remember, we were wondering why it is that we need to determine the total amount of drug in the bottle, apart from using ratio and proportion to determine what the final diluted volume will be. It's very important also for the drug regimen. So we are using a stock bottle of 250 per 5 mil that contains 4,000 milligrams of drug. And we also are going to be adding 135 mils to that powder to end up with a volume of 160 mils. But can that 160 mils cover the amoxicillin? Now, the first thing that you would have to do is determine the total amount of amoxicillin that will be needed for this drug regimen. So that means you're going to have to multiply 125, it's 125 milligrams every 6 hours times 7 days. So that's 125 times 4, which is 500 milligrams per day. And you're going to do that for 7 days. And that's 3,500 milligrams. That 3,500 milligrams is what the patient needs to cover the drug regimen for the 7 days. How much of the drug is in our stock bottle again? 4,000. So do you think that it will cover it? Absolutely, right? Another quick way of doing it is to just calculate the term in terms of volume. 5 mils is to be given because 125 milligrams now would be 5 mils times 4 times a day times 7 days, which is 140 mils. So this indicates that your diluted suspension will cover the drug regimen for this particular patient. All right. Okay. All right. So we used ratio and proportion. Now we are going to use CSVS. Now this is for our CSVS queens and kings who love to use the CSVS equation, but I thought it prudent for us to understand the ratio and proportion, reason of the question first, and then you can always use your CSVS. So we're going to use this part of the question because we can't use CSVS to calculate all the other things. So we're going to use only this part to demonstrate how CSVS equation concept can be used. Amoxicillin 125 milligram every 6 hours for 7 days. Doctor wants 125 milligram per 5 mil, and you have to calculate the amount of water required. First, you have to determine what the parameters mean in the equation. So CS is 250 milligram per 5 mil. VS is 80 mils. They are the stock. CD is 125 milligram per 5 mil, and VD, you don't know it. So we're going to solve for VD, which is 250 milligram per 5 mils times 80 mils divided by 125 milligram per 5 mils, and end up with a volume of 160 60 mils. That's 1, 2, 1, 2, 3, 4, 5 steps. You see why you have CSVS kings and queens, because they find it so much easier to use. But it doesn't end there. We need to determine the volume of water to be added, which is total volume minus volume occupied by powder. You would have calculated the volume occupied by powder previously if you were me. So therefore, you just subtract the 25 mils from the 160 and you get 135. All in one slide. Fabulous. So we have come to the end of reconstitution. We haven't done any examples with admixtures, but I'll be sure to be giving you in your practice exercises on the relevant platforms that we'll be using. So I would like for you to go through this video and then do the questions. All right. So thank you so very much for your attention. And we will see you. All right. Thank you for listening, and we'll join each other another time.